Welcome everybody if you're joining the Social Prescribing Employment, Adult Education, Mental Health and Loneliness webinar. That's quite a mouthful. As you're joining, just to let people know that we're actually recording the session because we want to be able to share it with anyone who couldn't make it today. So you'll be off screen and muted for most of the session, but we have got some interactive elements and the opportunity to ask questions. There's a chat box, so as we go through the session, if people want to put any questions that they might have in that chat box, then we'll be picking those up as we go. I'm going to kick off. We've got a good number of participants. We had huge sign up for this event, huge amounts of interest in this topic. And my name is Gemma Gilbert. I'm Director of Transformation at Healthy London Partnership. It's Mental Health Awareness Week this week for anyone who's missed the big news or hasn't been on Twitter. And the theme this year is loneliness. So we thought, what a great opportunity to think about how does social prescribing support mental health and loneliness. But not only that, how does social prescribing support the employment and education needs that are often coupled with mental health, loneliness. So we're kind of Healthy London Partnership. For people who don't know who we are, we host a London Partnership for Social Prescribing and essentially create a collective community for action across London to scale and spread social prescribing. Now, social prescribing, for anyone on the call who doesn't know what that is, essentially it's looking beyond kind of health prescribing and medication and saying that actually for a lot of needs that people have in communities, there's a whole load of support out there, but they have trouble navigating it. And social prescribing link workers have a really important role to play to work with individuals on their personal health needs and goals in partnership with what's available in communities and beyond, and help create a package of care for them that goes well beyond medication and into social prescribing. So you'll hear more about that as we go through the session. But we thought, what a brilliant opportunity to talk about, because often we work in silos, don't we? We work in silos, whether we're working in education or in employment or in the health system. But actually, individuals come with these multifaceted needs that are best approached by us all working together collectively. So we thought, what a great opportunity to focus on this issue of how does mental health impact employment and how can we better support individuals to get the right things in place that mean that they can achieve strong employment and continued employment. Because employment is so important in terms of loneliness and in terms of mental health. Having a job can really give somebody purpose. It can give people that social connection that they've needed. It can give them the financial stability to move on in their lives. And that can really support health and wellbeing improvement. So really good opportunity today to look at all of this. We've got a great list of speakers. We've got Professor Kevin Fenton from the Office for Health Improvement and Disparities. He's our Regional Public Health Director. He's also the statutory advisor to the Mayor of London, Sadiq. We've got the Skills and Employment and Health lead from the GLA, who's going to talk about the employment strategy and policy for them. We've got Naomi, who's coming to talk about the work of the Learning and Work Institutes and adult learning and how that can improve mental health and wellbeing. We've got Ben Taylor from Mind, who's going to talk about practical approaches to tackling loneliness and better mental health in London. And then we've got a fantastic case study from Lizzie Woodward, who's really at the coalface of social prescribing from One Westminster, who's going to give us a bit of a lived experience insight to some of the cases that she looks after and how she supported people to improve their employment position and their mental health and well-being. But we'd like to start with a quick Slido poll, which I'm hoping my team in the background are going to be able to bring up. So for anyone on the call, there's a Slido link. It's on this slide here. You can sort of see, but it's also been placed in the chat box. So you can just click the link if easier. So you can either use your phone and put it over the codal square, or you can kind of go to the link in the chat box. And we're going to be asking a series of questions on the Slido and looking for your answers. So do go in there and just take a few minutes to do that, and we'll wait for more people to join. So the first question's already up, and you'll be able to see who's on the line in terms of different job roles. And it should be on your screen now. So You know, we were really pleased to see this massive range of individuals in this space. But it also presents a challenge, doesn't it, around who is the family of people in my local community who are all working on this same issue, because we've all got lots of different job titles. But there's a whole range of people here you can see who are interested in this topic, who probably would be interested in getting together in a local community setting to work out solutions together. So fantastic to see people from employment, wellbeing roles, occupational therapy, even sort of project directors. I know there was somebody coming up who looks at population health management, but people who work on skills and training. It's a great question to ask because it helps you see who's on the call. Always hard in these webinars, so so good to see. Okay, we've had a really good number of answers to that question now, Justina. I'm wondering whether we can move on to the next one. Anyone doing the Slido? It's now the next question's appeared, so do add your answers to that. You're already doing that, so that's great. Wow, high confidence. This is great. That's sometimes a symptom of having in the room the people who are most interested already in the topic, who are already like the seekers to find the solutions. But it's really good to see a lot of people are confident, but we've got a good proportion of people who are sort of not confident at all. So hopefully for you at the end of this session, we'll have improved that confidence, or at least given you some ideas around how you can start to really build those networks around signposting. Okay, next question's up. What community-based activities are you aware of or refer to that may support people with employment, adult education and mental health? I'm sure you've got like a whole shopping list of things that you bring to bear when you're supporting somebody with these issues, but it would just be good to see a couple of examples. Perhaps there's a particular service that you're really proud of in your community that you just know it's really brilliant at supporting people. Or it might just be, you know, a person in a particular role, or it might be a standard referral route between statutory bodies, but just really good to hear what people use. And by the way, after this session, we will share back some of the answers that people have given, so you can see the sort of range of support that's out there. It's always really good to borrow and steal ideas from different communities where they've put something in place. Perhaps it doesn't exist in your area, but you can go out and find out about it and talk to each other locally about, was this something that you'd like to kind of create for people in your community as well. It's also showing you the great range of support that people might access in terms of different needs. Now, we know that a lot of people in this situation probably struggling with financial instability as well. So as well as things like wellbeing, exercise and so on to support mental health improvement, often there's some really practical things like, you know, access to food for food insecurity reasons, support with housing, lots of whole range of advocacy that's needed, but also some really practical support around getting back into work, support with training and so on. Thank you all for just doing that exercise. I think there's some really rich information there. It's a question we might ask again, actually, of the wider network and people who haven't attended, just so we can pool all of that rich knowledge that people have in the work that they're doing. But I'm going to go straight on the agenda because we're already sort of about 5 minutes behind on our start, and invite Professor Kevin Fenton to talk to us, particularly to set the scene around the public health challenges London has around employment, particularly around things like the cost of living crisis, and what that means post-pandemic, and why this work is going to be so important in the future. So Kevin, big welcome to you. I'm hoping you're now going to be able to come on screen with the slide deck.
Wonderful. Thanks, Gemma, and good afternoon, everyone. I won't be using the slide deck today because I thought that this is such a really important time and topic that rather than focusing on the slides, I think I'd like to just discuss a few reflections with everybody here. But let me begin by saying acknowledging Mental Health Awareness Week, and I'm so pleased that the focus is on loneliness. Every opportunity that we have as a city, as practitioners, as citizens in London to focus on our mental health and well-being, every moment is a good moment. The pandemic has been challenging. The emergence from the pandemic is difficult. People have been struggling and are struggling with a variety of other issues. And so everything we can do to raise awareness, to provide the resources, to signpost individuals, and to support individuals at this time, all those actions are really, really needed. So today, what I thought I'd do is to do three things. First of all, just to do a little bit of reflection on our city and the experience of having gone through the COVID pandemic and what that means for us in terms of our ambitions to improve the health and well-being of Londoners, including their mental health. Second, I'd like to reflect a bit on Mental Health Awareness Week and why the focus on loneliness is so critical, and to build on some of the earlier things that you said, Gemma, related to those wider determinants of mental health and mental ill health. So looking at our economic realities, our social realities, and other social determinants, and why our approaches to tackling loneliness must be as holistic as possible. And then finally, perhaps a challenge and a reflection on the role that social prescribers, those who work within and those who connect communities, what we may do together at this time. So many of you may be aware that there is a health and care vision for London. It was developed by health and care partners across the city in the pre-pandemic period, and it really set a very broad and bold ambition for London to be one of the healthiest of the global cities and one of the best global cities in the world to get high quality health and care services. As we have emerged through the pandemic, it's become absolutely clear that all of us working not only in the immediate health and care system, but in wider society or wider partners must work together for the good of health and well-being and to be able to tackle health inequalities. And this has certainly come to the fore in our experience of the COVID-19 pandemic. We're getting through the successive waves of the pandemic required us to work beyond health and care, but to work with businesses, educational institutions, the local community, the faith community, partners that perhaps had not historically had as strong a relationship with the health and care system as previously. But now, as we've emerged from this phase of the pandemic, it is absolutely clear that these partners must be part of that journey. As I mentioned earlier, mental health and loneliness have been a key feature of our collective experience of going through the pandemic. And we often speak about the direct impacts of COVID and the indirect impacts of COVID. So whether you were unwell with COVID, have had to deal with long COVID, or had to deal with the complications of infections, those can have significant direct mental health implications. But the wider impacts of the pandemic, the experience of lockdowns, the disruption in schooling, the loss of jobs, the instability of housing, have also contributed directly to poor mental health. And that is why during the course of the pandemic, we saw such a massive surge in queries for support for mental health, including anxiety and depression. This was especially so across all age groups, but especially among our young people. And we also saw, especially in the first year of the pandemic, significant increases for emergency care and admissions for mental health services. So that's the experience that we've had through the pandemic. But it hasn't always only been a story of negative impacts. And all of us can reflect on the 2 years and think about the lessons that we've learned about our own personal resilience as we've gone through the pandemic, and the things that we've learned to do that sustain us, that replenish us, and that helped us to deal with the stresses. So as we reflect at this Mental Health Awareness Week on some of the challenges of our mental health and specifically loneliness, I also want to bring to the table the lessons that we have learned on resilience and how we can use those lessons to help us to address both mental health issues and other health issues. Now, loneliness is, as you can imagine, a really important topic for us to focus on because it also has significant impacts on individuals, both their mental health. it affects their physical health, the way they engage with society, the way they engage with their local communities. It can have a detrimental impact on your healthy life expectancy and your life expectancy as well. And we now understand that there are a range of tools and interventions which are available for us to support individuals not to be lonely. So loneliness itself isn't a mental health condition, but we know that feeling lonely and feeling isolated has that impact on our mental health. And of course, poor mental health exacerbates loneliness. And so therefore the focus on this for this week is really critical for us to think about how we build resilience among Londoners. Now, the Mental Health Foundation, which leads on the Mental Health Awareness Week, talks about the importance of our connection to other people and our connections to our local communities as being fundamental to our mental health, and finding ways of addressing this can help us to tackle the epidemic of loneliness. And that's why in the city, in London, we have been working across partners and in many boroughs actually to focus on loneliness. Many of our boroughs across the city have developed loneliness strategies. As you know, the government has been a key proponent of tackling loneliness and isolation. There have been government reports and strategies on that as well. So as we emerge from this phase of the pandemic and we're dealing with some of the after effects of COVID, loneliness is certainly a part of that. Some of that loneliness is because of the disruption of our family and social networks throughout the course of the pandemic. Some of it has arisen because of the changing working patterns that we now have as we grapple with either working from home or hybrid working. And for many people who've had significant life changes during the course of the pandemic, the loss of a loved one, the rupture of a relationship, change in life circumstances, that can also result in loneliness. Now, just to compound things a bit further, and as we talk this afternoon about the way we work differently, the loneliness that we're experiencing now, the mental health challenges post-pandemic may well be further compounded as we move through a period of economic instability. And for those of us working in health and care, it's so important that we pay attention to what's happening in the wider society, because the fuel crisis is a health crisis. The cost of living crisis is a health crisis. Our inability to tackle some of those wider determinants, if you're not able to put food on the table, the growing use of food banks by a number of individuals within our community, all of these factors, which are now part of the lived experience of many Londoners, will have a direct impact on mental health and well-being and loneliness. And there are a lot of data which are now confirming the impact that we're seeing, both of the pandemic on the economic challenges that we're having in the city and the vulnerability that we may have in the city as we experience the fuel crisis and the cost of living crisis. And I raise this issue because it's important that we don't make assumptions about Londoners. And I know many of you working in communities know that these realities for many Londoners of being part of the working poor, for example, being part of the sector of our community, which really is relying on government support or support from charities. There's a significant proportion of our populations which are vulnerable. And at this time, the impact of the pandemic, loneliness, and of course the economic instability will clearly have a negative impact on our mental health, well-being, and loneliness. So there are quite a number of things that we're doing across the city to address and tackle loneliness and to support mental health. As you know, it's not just about providing high quality mental health services. It's about signposting individuals to a range of assets that they have within their communities to support their resilience, to support early signposting, and to ensure that if they are in contact with services, to ensure they're supported post that contact to return to healthy and productive lives within the community. And as we focus on Mental Health Awareness Week, now is the time for us to think in a more holistic way about our mental health work and assets and the important role that we play, those of us involved in social prescribing, in linking individuals to community assets. So I am going to end here, and I'm going to end with the challenge that I promised at the beginning, that, we're now in a challenging time. No one would have anticipated we'd have gone through a global pandemic, be faced with war in Europe, and now be tackling with major social and economic upheaval and an economic crisis. And these challenges will have multiple impacts and unknowing impacts on our colleagues, our family members, or people living in our neighborhoods. The challenge I think that we will now have is, how do we continue to find the space to talk about our mental health and our resilience and the assets that we have? How do we signpost people effectively? And how do we support the most vulnerable among us during these most challenging times? I'm looking forward to the session today, and I'm looking forward to hearing your suggestions on what more we can do together at this time. So Gemma, with that, handing back to you.
Thank you, Kevin. There was one comment in the chat box, which is something we're going to probably pick up later from Amy. I mean, about the challenge at the moment that people are having accessing general practice, and I know that's not sort of fully your purview in terms of public health, and it's something that we in the health system are really working towards trying to support that improved capacity and capability. So we'll come on to some models that we're doing later on, actually working with general practice, Amy. So I'm hoping that there'll be some answers in there, but my question, just Kevin, from that really is this sort of navigation piece, isn't it? I mean, it's about, sometimes it's not even the GP, but it's like that sort of the navigation and how a sort of a local community work together to support individuals with that navigation. Yeah. Is that something that you're sort of seeing becoming more widespread across London in terms of how public health teams are approaching supporting public health improvement?
I think, well, first of all, just to agree with you that, it is heartbreaking when you know there are lots of assets that can help people within a local community, but those assets are hidden, either actively hidden because the assets are not able to promote themselves, not able to promote their work, or they're relatively hidden. In other words, they're doing really good work, but nobody knows about them. They're not being promoted. They're not engaged with local communities. And I think the COVID pandemic has really taught us the importance of deep and meaningful and sustained community engagement and mobilization, so that community members are able to speak to their own and with each other about those assets in place, and that we work with local communities to ensure that we continue to promote and engage on the available services. And great examples of this, and I'm sure many of us were involved with it, was tackling the COVID vaccine hesitancy, and how do you provide materials in different languages, using different images, using community health workers, COVID champions, to engage with community members so that they were aware of the assets in place and were able to either hold hands, answer questions, etc., to help people to get to the vaccine. There's some core principles there, I think, Gemma, that we need to have as lessons from the pandemic and help to incorporate it into our day-to-day work. And that's why I think social prescribing is so important, because we have social prescribers, we have these ready-made links within communities that, through, I think, much more strategic partnerships with community organizations, in addition to VCS organizations which are providing services, we can do a much better job of some of that promotion, access, and linking. So great question, and it certainly is the next set of challenges that we'll have.
Yeah, fantastic. And we're picking that up as a sort of a number of people have expressed a similar thing, that pain point of getting to see a GP, and increasingly we're thinking about sort of how a wider GP team can support access into a range of services, but sometimes it is the GP that's critical, and we know that those services are really under demand at the moment as we recover and come out from COVID. So we'll come on to some of those questions as we go sort of through the session, but I just want to say a big thank you for Kevin. I'm sure it's hugely reassuring to people on the call to hear just how cited you are on some of the real challenges that London communities will be facing coming out of COVID, and thank you for your leadership and advocacy in those. So we're going to move on the agenda now to our next speaker, and I'm going to invite Faru Rahami, from the GLA, the Greater London Authority, who's a senior manager for skills and employment strategy and policy. So she's going to talk to us about some of the work that is being championed by the Mayor and led by the Greater London Authority. So welcome, Farah. I hope I got your name right. I've really tried to look at the pronunciation on the internet beforehand. So go ahead, over to you.
Thank you, Gemma, and almost got it right. So it's Fru Romani, and thank you for having me here today. And apologies, I'm stepping in for the Deputy Mayor, who unfortunately couldn't be with us, couldn't be with you all today, but hopefully I'll do a good job in his stead. So as Gemma said, I'm the Head of Strategy at the GLA Skills and Employment Unit, and I'm here to say a little bit about how City Hall is supporting health and wellbeing from a skills perspective, so that more Londoners can effectively benefit from London's opportunities, both economically but also from a social perspective, enabling them to better succeed and thrive in society. So the Mayor recognises the value in social prescribing, and indeed in enabling more Londoners to access social prescribing is certainly a key ambition that's recognised across City Hall, and in particular within his Health Inequalities Strategy. As part of that ambition, he wants to ensure that every Londoner has access to a social prescription in London by 2028. And social prescribing is also a key feature of the London Recovery Programme's mental health and wellbeing recovery mission. And as such, there's lots of work going on across the GLA in an effort to mainstream social prescribing into all of our activity. A number of projects have been established which feature social prescribing, and some of these include a focus on promoting things like arts, culture, and that's certainly a kind of key area for us in terms of the skills provision that's provided through some of our adult education budget, but also through things like green spaces and social welfare legal advice. And on learning in particular, which is what I'm here to talk about, we're looking at how we can better incorporate social prescribing into our activity, and in particular adult education, in order to deliver better outcomes for Londoners, and that's certainly a crucial part of our mission and aim following the impacts that the pandemic has had on many people in London and across the world. So the Mayor's Health Inequalities Strategy recognises the wider social determinants of good health that span social, economic, environmental factors, and the influence that that has on health, well-being, as well as inequalities. Education, as we know, is one of these determinants, and there's lots of evidence to demonstrate that in terms of seeing the strong association between life expectancy, mobility, and health behaviours within educational attainment. So taking part in education itself can be beneficial for health, and we're seeing lots and lots more evidence of that, and in particular the impact that it can have on well-being, particularly through the experiences that engaging in learning can have, as well as the social benefits of connecting with others and learning within community settings. So currently City Hall spends around £320 million a year on adult learning courses in London, and that's through the devolved adult education budget. This reaches around 200,000 learners, or Londoners rather, on average per year. And through this funding, we fund a range of learning opportunities, and this includes courses such as English and maths, English for speakers of other languages, a whole raft of vocational courses at entry levels all the way up to higher level skills, including in support for things like digital, green occupations, and also quite crucially in terms of this discussion today, community-based learning. Having control of the AEV has given City Hall and the Mayor a lot of opportunity to help improve the connections between learning, education, health and well-being for Londoners, and increased social prescription can take this further. We're currently we've just launched a new London Learner Survey, and through this we'll be monitoring the impacts of how education and learning participation is affecting people's well-being and health, as well as any kind of economic outcomes that learning can have. To further maximise our understanding about what more we can do, we also had to establish and understand how social prescribing to adult education is currently working in the capital. We're really pleased to have partnered with the Learning and Work Institute to carry out this research on social prescribing to adult education, which Naomi will shortly speak to in greater detail. As a result of the research that Learning and Work undertook, we now have a much better understanding of the extent of social prescribing to adult education that currently takes place in London and the challenges that are faced by the system. And it's clear that there's much more that we can be doing around this. But it's also really great to see that there is already some really good foundations there that we can build on. So the research helped to inform the development of the Mayor's Skills Roadmap for London, which the Mayor published the end of January this year, and this sets out his ambition for how he plans to ensure that London Skills Offer better serves the needs of London's communities and local economies by ensuring learning is more accessible for all residents, is locally relevant and makes connections to other services and makes an impact on people's lives. And as I said, both from an economic but also crucially a social perspective. It includes a commitment to use the Mayor's convening power to support social prescription to adult education. And as I said, we're really keen to build on what's working well and try and scale up and spread effective approaches so that social prescribing into adult education becomes widely available across London and across different communities. So to deliver on this commitment, we've published the Learning and Work Institute's research on the GLA Skills Employment Data Store pages. And this is accompanied by a guide aimed at health and social care services as well as adult education providers. What the guide showcases is existing, innovative and effective practice that could be replicated or adapted in other settings and across different localities. It promotes partnership working both at a strategic level but equally operational as well to create and develop sustainable social prescribing services to learning. So I'm hopeful that this provides a useful resource to many of you here today or partners that you're working with, and we're really committed to do more in this really crucial space so that more Londoners can get the help that they need to succeed in life but also in work. And I hope to hear more in terms of feedback on the research that Learning and Work have produced, and again keen to hear of any more examples that we can build on in terms of making social prescribing something that happens across all of London into education settings. So thank you very much for having me here today, and I hope the rest of the event goes well.
Thank you, and a really good presentation on behalf of the Deputy Mayor. So thank you for stepping into that. So I'm going to move us quickly on because our agenda's quite tight today, but to Naomi Phillips from the Learning and Work Institute. I think you've already had a good intro there. So can you tell us a bit more about the work that you've been doing, Naomi?
I'm so pleased to be here today. I am just trying to work out how I can do that. So that's great. So I hope you can see my slides. I'm going to just talk a little bit about the work that we've been doing in partnership with the GLA on social prescription and adult education. So just to kind of define the terms that we're looking at. So adult education or adult learning involves opportunities for adults to engage in activities to develop new skills, knowledge and abilities. And it can mean the kind of formal education, such as learning towards a qualification, but it also includes non-formal activities, non-accredited activities such as arts, gardening and managing mental health and well-being. And adults we know engage for a whole variety of reasons, including to develop new skills, including to connect to other people and to reduce social isolation and to improve their mental health and well-being. So actually we see that adult learning can be a really key activity and provision for adults to join in order to improve their mental health.
Naomi, I'm just wondering whether we can adjust the screen because some of the slides have been cut off to the right hand side for people on the viewing. I don't know if that's possible.
Sorry,
is
that better?
That's better. That's much better.
Okay.
Thank you.
So what we do know is that there are, you know, a huge amount of policy sort of going on, and that's just been outlined as well by the previous speakers. And just to say that we are kind of undertaking this research and looking at this in the context that we know that mental health is a growing need. So we know from providers, from social prescribers that we've spoken to, that they are expecting the need to go, they're expecting their client list to go up, unfortunately. And therefore it's really important to understand a bit more about what works and different solutions that we can be putting forward. The other issue, of course, is that there is a lot of pressure on the NHS at the moment, but the clinical route isn't always the most effective route if you're looking at people's holistic needs. So social prescribing, as has been described, can actually do both, helping to make sure that people's outcomes are met, so that people have their whole kind of holistic personal needs met in addition to their clinical needs, but it also can help to reduce pressure on the NHS as well. So it's a really important issue that we're looking at, very timely. We've already spoken, Gemma, you outlined what social prescribing is, so I won't go through this, but it's on the slides that we'll share as well. And the research methodology that we use, well, we basically spoke to a lot of people, and this really builds on other research that we've done. So we've done lots of kind of scoping. We spoke to stakeholders, we spoke to practitioners, and most importantly, we spoke to learners about really what works, what doesn't work, where are the blockers, and we focus this in London, of course. And so the main findings are that actually there's a huge amount of potential here. There's a huge amount of potential for a wider rollout of social prescribing. So what we find is that it's happening in some places, but not everywhere. But it's so heartening to hear from Professor Kevin Fenton and that the Mayor of London are all prioritising this and actually want to see a much greater take-up and use of social prescribing as one tool to connect people into community services and into non-clinical services. It's not the only thing that we can use, but it is an important tool to support people. So there's lots and lots of potential there. One thing about the data is that actually the data is a bit mixed. There isn't a huge amount of quantitative, so really getting the numbers through about kind of what's actually happening and then the outcomes of people. So we're recommending really that actually a bit more research is needed in this space, and particularly to look at the numbers as well as the qualitative thing, as well as how does it feel for people. Strategic coordination could be improved actually, and we're making recommendations for how new networks can be built, and Professor Fenton outlined the kind of all sorts of different people who are involved and beyond the usual suspects, but actually right across community services, across health, across employment, across adult learning, and actually there's the landscape is ripe for building those new networks. And the adult education budget, as we've just heard, is really, really important here, but actually more could be done to improve the prioritisation of that in order to commission services to improve health. And then policy recommendations, improve the visibility of adult education as one area where social prescribing can actually go into to improve mental health and well-being, more prioritisation of the budget and to support with commissioning, more standardised approaches of monitoring referrals and measuring outcomes. So all of the social prescribers on the call will be kind of aware about actually kind of how we monitor and collect the data for this, and that's going to be increasingly important. And then actually we're looking at the systems level, so it's not just kind of what's happening on the ground, but actually looking across the system and how can the system working be improved, how do those strategic partnerships be improved to support this. And then finally, I will share the link if it hasn't been shared yet, but we've developed a toolkit. So this is a real practical guide for practitioners on the ground, kind of the what, why, how of social prescribing into adult education, what we mean by it, how we take a systems approach to building partnerships, what that really looks and feels like on the ground in a really practical way that's simple but effective, and different approaches to data sharing and monitoring outcomes and sharing good practice. So I'll share that. I'm going to stop now because there's plenty of other speakers, but I'll share that toolkit and I hope that's going to be useful for people on the call. Thank you so much.
Thanks, Naomi. And yeah, we're really moving from some of the policy work, which we thought was important to tell you about in terms of, you know, what people are kind of recognising is a big need for the capital, and how we're joining up to work out, well, okay, from policy, how do we support and enable London system to turn that into reality, and be that in terms of supporting capacity capability. Some people in the chat box have been talking about, well, this is a huge job, all this coordination, and so we'll come on to some sort of practical ways that communities are starting to sort of look at that, but also we're thinking about how do you create the right enablers in the economy of London, the social economy of London, to be able to just create more opportunities for more of this social prescribing work. Okay, I'm going to move us now straight on further into the sort of practical approaches and invite Ben Taylor, who's joining us from Mind in London.
I'm here representing Mind in London, which is a kind of partnership of all the local minds across London. Yeah.
Fantastic. Over to you, Ben.
Great, thank you very much. Yeah, so I'm just going to speak a little bit from a Mind perspective about social prescribing from employment and education for people with mental health problems. So coming from a perspective of and in the context of voluntary sector mental health service provision with people who are undertaking a social prescribing role, though their posts might not be defined as social prescribing solely. Could I have the next slide, please? So just a little bit, and I won't spend too much time on this because other speakers have already spoken about the benefits of education and employment for people's mental health.
Ben, sorry, you've got some background noise. I'm just wondering if anyone's got their microphone on, perhaps one of our previous speakers, if they could just mute themselves. Thanks, Ben. Just didn't want you disturbed.
No worries. Thanks very much. So some of those benefits obviously around increasing people's skills, improving self-confidence and helping people have a sense of self-efficacy and control over their life and a sense of achievement. It's also really positive and obviously a key theme for today in Mental Health Awareness Week in terms of reducing loneliness and isolation and those sort of social connections and relationships that people form through the workplace and through education environments can have a really massive impact on people's well-being. And it can also reduce other indicators of poor mental health. For example, we know there's a very strong correlation between people who have low incomes or living in poverty and mental health problems, and being in employment is really helpful in helping to address that. Next slide. So I'll just say a little bit about our approach to social prescribing in local minds. So firstly, we're very much coming from a sort of individualized approach to supporting people, not a kind of one-size-fits-all approach, but being very tailored in the support that we provide. And that means starting with the unique histories, aspirations, interests and experiences and needs that people bring and treating them as a unique individual, working with those aspirations and interests and making sure that the support they receive and the resources and organizations that they're signposted to are really going to fit with what's right for them and what they want for their lives. We try to maximize people doing things for themselves. So, you know, it's not necessarily about us referring people. It's maybe more about people kind of being supported to make those connections themselves and trying to encourage people to be as much a part of that social prescribing process for themselves as possible. But we also recognize that sometimes people do need some support, and that might take the form of working with them in advance to prepare effectively to be able to access those opportunities, you know, whether that's through in work or employment. So for example, in a work context, it might be about helping to develop a CV or prepare for an interview. And sometimes people will also need more practical support in terms of making those introductions and support to begin accessing a new environment or opportunity. And so I think that it's getting that balance really between encouraging people to do as much as possible for themselves, but also recognizing that sometimes these things are quite anxiety provoking and people might need some additional support to kind of get over the threshold and get involved. Next slide. I wanted to say a little bit about one particular approach to providing support to access employment for people with mental health problems, which is the individual placement and support, or IPS model of providing employment support. And this, some kind of key features of this, it's based on rapid placement into real jobs, so kind of competitive employment. There's not lots of time spent on work preparation or placements. It's about getting people into real jobs. We do that, and it's kind of core to the model that's matching people to their own skills and interests and preferences. So not just getting people into a job, but getting people into a job that's really going to suit them and work for them, and therefore is more likely to be sustainable. And there's some examples there of some of the jobs that have been secured through support from the IPS scheme we run in Bromley and Greenwich over recent months, which gives you a sense of that sort of breadth of the type of roles that people might be moving into, and I guess showing that's very much matching to the sort of skills and aspirations that people bring to it. IPS also employs an approach of having time unlimited support once someone's in a role, both to the person who's the employee who's accessing the support, but also to their employer. It also includes benefits counselling, so that people can be really aware and manage any impact on their benefits. And key to the model is that it's integrated with clinical mental health teams. So the IPS specialists are embedded within NHS Mental Health Trust teams. And that enables a real joining up with the sort of other support that people are getting around their mental health. And research shows that it's twice as effective as other employment schemes for people with mental health problems in getting people into paid employment. Next slide. So just a little bit about the kind of benefit of involving third sector mental health providers in this type of work. We've obviously got expertise in mental health, and within that context in providing non-clinical support that kind of complements the clinical input that people might also be getting. We've got really strong connections in local communities and are very trusted by those communities, and in particular where people might be reluctant to access statutory sector mental health services, they might feel more comfortable coming along to a mental health charity. We're very flexible and agile and able to kind of respond quickly, and we have access to a different workforce from the NHS and a good ability to recruit from that workforce. And we're able to kind of connect people up through our relationships and networks to the wider voluntary and community sector and other sources of support. And of course, we provide really good value for money. And last slide, I think. Yeah, so just finally, we've got I want to say a little bit about integration with clinical services. So we've got lots of staff within BLG Mind who work in an integrated way with NHS staff, and this has a number of benefits. Firstly, it frees up the clinicians to focus on the clinical work that they have expertise in. It also makes sure that there's a kind of joined up approach between that clinical support and the support around the rest of life issues that have such a massive impact on people's mental health and well-being. And people being able to have some specialism and real focus on social prescribing means that they can bring a really strong knowledge base and a skill set that's specific to that process, which I think helps it to be a lot more effective. Thanks very much. That's all from me, and I'll hand back to Gemma. Thank you.
Thank you, Ben. That's great. Well, before we move on and to hear about a project that's really tried to kind of build a strong kind of operating model for work and health at a place-based level, I would like to sort of just invite Lizzie Woodward first to talk to us about a couple of the cases that she works with. I'm sure a lot of people on the call have cases they can think of. I've certainly got people I've supported in my own friends and family network. Lizzie, if you're there, if you could come on screen and just tell us about a couple of cases, let's try and illustrate what is it that we're trying to solve here for people.
Thanks, Jenny. I'll just try and share my screen. It's great to be here today. I am a mental health social prescribing link worker, and I work for One Westminster, but I'm based at the Community Mental Health Hub in South Westminster. And my colleague Grace is here today also. She is a senior social prescribing link worker based also at the South Westminster Community Mental Health Hub, and I'm sure she'll be happy to answer some questions near the end. And today I'm going to go through a few case studies I'm currently with some clients I'm currently working with. So the first case study is a woman who's 46 years old and she has a diagnosis of schizophrenia. She was referred to social prescribing because she was interested in getting into social activities and employment and looking for employment opportunities. She hadn't been in employment for a very long time, and she was very concerned that she would be judged when she was finding work because of her mental health diagnosis. And she had a lack of confidence in really getting into employment. So I started by referring her to the employment specialist. We're very lucky working in a community mental health hub because there is an employment specialist, and often I will refer someone to them. And I also linked her with activities. So she started doing crochet and she's really been loving that. And she's had more social interaction. And then after several sessions, exploring things with her, discovered that she really struggles using her laptop. And one of the main barriers to her finding work, partly because she used to be self-employed, was that she wasn't able to advertise her profession and she wasn't able to access things online. So I referred her to a digital skills course. And so the second case study is a woman who has a diagnosis of PTSD, and she was referred to social prescribing because she was very socially isolated. She was in her flat every day and she didn't see anyone or have any activity in her day, and she had very low motivation, lack of hope for the future. When I started working with her, she didn't mention the thought of employment or getting into anything. She just vaguely liked the idea of joining a yoga class. It was kind of all it was. And so I went along with her to yoga because she had very low confidence. And when we were there, because we went to Yoga at Mind in Westminster, she learned about the BEST programme, so that's building employment services, and I should know what the BEST programme is. It's formula. Building employment skills and training, that's there. And she, can you see my screen still?
Yeah, we can see your screen, it's okay. Yeah.
Okay. And she then started talking to me about joining further activities and started talking about like future employment. And that's something that it was just great to hear from someone who was could not see any way path forward. Then talking about possibilities and hopes and purpose in the future. And I think a lot of the time, at least from my perspective as a mental health social prescriber, it's like a stepping stone before going on to potentially employment, maybe starting off with small steps and maybe going to one activity. and then maybe they start thinking about just an adult education course and kind of going from there, rather than going straight into employment, because that can be very daunting for a lot of people that I work with. And this is a case study from someone in my team. So this is a 50-year-old female with a diagnosis of EUPD, and she was referred to social prescribing, social isolation and further education. She had several discussions with a mental health social prescriber about what she would like to gain from the social prescribing service, and she had a desire to do something she would enjoy, with the possibility of employment in the future, and finishing her health and social care qualification. Eventually she decided she'd like to get her English GCSE. However, one of the barriers is that she was worried that she wouldn't be able to cope because of her diagnosis, and she'd been out of academia for a long time. And then she was referred to my SPES programme, and she, when she began, she was a bit concerned about disclosing her diagnosis. However, the social prescriber talked through with her her concerns and talked to her about confidentiality, and then she felt more comfortable, and was supported by the college after disclosing that. And then at the end of the session, the social prescriber, she was attending English classes and had made social contacts in the process. So thank you for listening, and I think social contact in these situations, and just getting back into learning, like small steps, can really help someone's confidence and improve how they feel about themselves and their future, which has been my experience. Thank you.
Thank you, Lizzie. It was lovely to hear not just sort of what you did for people, but in a sense like how you encouraged them along. So, you know, going along to a yoga class with someone, recognizing their level of confidence and being really responsive to help that person really make the best of those opportunities that you've identified locally, and just sort of how quickly you've built a sort of set of assets around that might be useful for people. And sometimes it's hard, isn't it? Sometimes there are gaps and things that sort of are available in the community, and that can leave you feeling a little bit like, how am I going to help this person? But actually knowing what's there, making the best of what's there, and encouraging people to take up that option is came across really strongly in that presentation. So thank you so much. I'm afraid we're going to move straight on. We have got a Q&A at the end of this, guys. So if you're burning with questions and you want to hear what the panelists think about things, I've already sort of written a good strong list of things around funding for VCSEs, capacity for link workers, and identifying who can help and things like that. So we're going to come on to those after this, but I want to bring us on to our final speaker, which is Matthew Pike, who I know very well, has worked both with HLP and has been sort of the genius behind a new organisation called Health Place, makes it right. And he's going to talk to us about some work that he did, both with HLP in terms of supporting work and health initiative across London, which was just pre-COVID. Unfortunately, some of it had stopped during COVID, but then also what he's doing now and where he sees things going with his own organisation. So Matthew, over to you.
Thanks, Gemma, and hello everybody. Yeah, I'm Matthew Pike, and once upon a time, pre-COVID-19, if any of us can remember that far back, I led a programme in 3 London boroughs with a really wide cross-section of people and agencies asking what if we could really transform the experience of people who were unemployed, experiencing mental health problems. Now, together we did an enormous amount of work in a really short space of time. Together we built a vision of healthy minds flourishing in healthy places which were really creative in how they made use of the existing resources that they had to hand. We developed some really exciting, innovative prototypes, and then literally 6 days into live deployment, COVID-19 reared its head and our work came to a screeching halt. But nevertheless, you know, we've learned a huge amount from that experience, and in the brief time that I've got, I want to summarize what I see as 7 critical foundations for doing this kind of work in the future as we hopefully emerge at the other end of the pandemic. And I'm going to end with a free digital offer of support for any of you on this call who are interested in taking some of these ideas forward. So the first of those critical foundations is the importance of investing in the time and space for a really diverse group of people, to come together, to listen to each other, to understand each other's languages and interests and agendas and constraints, and therefore provide the basis for forging a common cause for long-term collective action. Secondly, the importance of place-based leadership. In each of the 3 boroughs where we worked, the leadership from the Public Health Directorate, including one Kevin Fenton, I should say, was critical. Alongside the tripartite engagement of DWP, alongside NHS, alongside the local council. So place-based leadership. Then the critical role of data and analysis, above all in turning up the dial, turning up the heat and the sense of urgency for collective action. We analysed London's IAPT data set and saw around 80% of people recycling through the system with some of their more fundamental issues remaining unaddressed. Awkward transitions from CAMS into IAPT. People struggling to get access to support. I saw these comments in the chat and I recognised them. People having to wait until their issues become chronic in order to get the support that they needed, right at the outset. In short, a system that was badly broken, and in need of radical thinking and a fresh approach. And bear in mind, this is a snapshot pre-COVID-19. The cardinal importance then, foundation 4 of a biopsychosocial approach, looking at people in the round, healthy minds flourishing in healthy places, focused on people's agencies, their priorities, what they want to do next. It may make more sense for people to get access to, legal advice or help with housing problems, or maybe access to physical activities. And if you think of somebody with depression as having like rocks in their rucksack, weighing them down, these are some of the interventions that take off some of the load so that maybe people are then more able to consider therapy with a capital T, or indeed, of course, access to work. And making that real means making available a really wide choice of support. That's the acid test about whether this rhetoric is real or not. Fifth foundation then is the imperative to transform access to support, and by those means address root health inequalities. Lots and lots of opportunity to use digital to do this, and I can talk about that later on. But much more important is a vision of opening up hundreds of new channels, access channels for support. Hundreds of people who can have those one-on-one conversations, be it the Citizens Advice Bureau or residents groups or homeless outreach or community groups or all those other professionals, understanding what matters to people, helping them over the threshold to engagement and activation. In other words, making social prescribing as a philosophy and an ethos mature and scaled across a local place. Sixth foundation then is taking a really creative approach to the existing resources and capabilities that all areas have, however disadvantaged they appear to be from the outset. Lots of people have talked about loneliness, the critical importance of forging new social connections, local social activities, really high quality peer support. I mean, obviously, there's a fundamental role here for voluntary and community groups and social enterprises. Less obviously, much less obviously, there are opportunities to redeploy some of DWP's resources within primary care. I mean, briefly, we trained up disability employment advisors, for example, and embedded them locally, I should say, with a rather different code of ethics. Opportunities to embed individual placement and support locally. And I agree with comments about the need for it to be more person-centered and flexible in some cases. Opportunities to draw on IAPT resources locally too. In other words, creating a really place-based, health-led approach. to employment support. And finally, just my final example, opportunities to use allied health professionals in a smarter way, for example, to provide capacity building and quality assurance for a kind of growing ecology really of diverse local support. And finally, the need to fund prevention properly. Now, we did a lot of work around the role of small grants in stimulating new micro, flexible, responsive provision, and that is a foundational importance. And it's great that National Academy of Social Prescribing has taken this forward, and I know Gemma and colleagues are also working on this with Healthy London Partnership. But that's necessary, but not sufficient. Yeah, what we need, in my firm view, is long-term co-investment from the key agencies involved, DWP, NHS, councils, and others, on the scale required, in response to local population need, in proportion to the economic benefits that accrue to each of those agencies, that the benefits that flow from doing this properly. I mean, for example, the NHS gains around £1,670 a year if they help somebody, some of Lizzie's examples, 3 points on the scale of patient activation. So that's my really rapid fire list of 7 things we need to get right. Creating that time and space to build common cause, nurturing place-based leadership, using data to turn up the heat, increase our sense of the urgency to act now on these issues, offering that really rich biopsychosocial menu of support, opening up many, many more channels of communication wherever people are, who are the right people to have those conversations, making social prescribing, in short, the norm, and funding prevention properly. So just to conclude then, I mentioned we've been working on a new digital platform. I mean, it's called Health Place, and it's designed to help people on this call deliver this kind of vision. If you want to take an asset-based approach to community, and I so agree with Kevin's words that is the number 1 thing we need to achieve. Well, we need to know what support is out there, yeah? And hence we've built a uniquely comprehensive database of national and local support, including lots of good resources, I should say, from Healthy London Partnership. Yeah, so that's available, free of cost, funded by NHSX, National Institute for Health Research, and others. It's designed to support those support conversations wherever they're taking place. We've got a brief quiz, a brief support finder conversation designed to help people find support which is tailored and, by the way, quality assured as well. And alongside that, there are, of course, opportunities to run local population campaigns as well for those people who are best reached with digital solutions. And we have what's essentially a digital dedicated personal assistant there to help people along the way. So I'll share a link. Anybody who wants to get in touch, delighted to follow up with you, and of course, delighted to respond to any questions in a moment.
Thank you, Matthew. And if anyone does want to find out more about that, we're really happy to share that in our links to that in our email out, and Matthew's contact details as part of that. Obviously, digital is one way to help people. Not everybody, so we would mention face-to-face, but actually it can help. Increasingly, people are using a lot of online and digital tools, so it's a really important asset to have in the bag. So we've got sort of a limited time now for Q&A, but I thank you very much to all the speakers. You've really sort of lined up the conversation really well. For those who are on the kind of panel, it'd be great if you were on my screen, and if I ask a question, if you can come to it. But I've tried to get bits from the box, and also we had some stuff submitted in advance. So I'm going to just kind of talk about a couple of areas that people have been raising, and let's see if we can kind of offer some insight into some of those challenges and ways we've thought about cracking them. So I'd be really interested to know particularly from Naomi or from Furrow, whether further education colleges are on board with social prescribing. Do we need to do more to let them know about what social prescribing is and join things up? Do you think they're pretty on board? Do you think it's something they're using at the moment?
So if I can just jump in there. So I think that further education colleges and other kind of adult education, adult learning providers are passionate, absolutely passionate about what they do, and they see the value beyond the kind of formal qualifications, but in terms of bringing people together, in terms of improving people's life chances, and that kind of human flourishing that Matthew spoke about as well, about actually learning for learning's sake, and having that as a strong link to health. So I don't think we need to sell it on that side of things. I think that further education adult learning providers really buy that and get that, and that's why they're in that business. But I do think what our research shows is that the networks between kind of adult learning, between health, between the community services, GPs practices and the link workers could be strengthened. Of course, in some areas you'll see where they're really strong relationships, and it's all about those personal relationships, you know, where things can go really well. We've seen how effective it can be to prescribe people or kind of link people into adult learning courses of the ones that they really want to do, but it isn't the same everywhere, and it's just a mixed picture. So I would say that the will is there, the knowledge is there, but actually those really important links between education, the NHS, and right across that whole kind of ecosystem actually could be strengthened. And that's where actually further research, as I mentioned, could be really helpful as well, so we really understand the numbers, who's going where, and what the outcomes are as well.
It was really clear from Matthew's presentation, wasn't it, as well, that you need this sort of leadership for place, which is really helpful if all the different agencies get together at a sort of a director or high level to say, yeah, we're going to do something together. But I'm really interested in Lizzie, your case study. So a lot of people in the chat box have sort of said, it's really hard the capacity and time to identify the services that are there. When you arrived in your role, did you get a kind of was there a ready shopping list of places to go? How did you kind of know where to take to go to for advice? Did people come to you? Have you created this?
I feel very lucky. I feel very lucky because I work for a charity that has a resource manager. So her role is to keep all the resources up to date and collate it in a big Excel file. And then I work with a lot of experienced social prescribing link workers who have a wealth of knowledge, including Grace, who's here as well. So yeah, I feel like I've been very lucky in being able to find resources in the local community in Westminster. I know it's a mixed picture in other places.
So I'm just interested, do you have like a strong working relationship with the local job seeking kind of centre or the employment office? Do you have routes into those things as well, or is that something you're still building? Or
I am not sure about the social prescribing link workers who are based at PCNs. For me, because I'm based with a community mental health team and there's an employment specialist there, if someone is really interested in getting back into employment, I would refer them straight to them. So usually I have people who are thinking about it but not quite confident.
Yeah, I'm really interested in whether a conversation in a place, if you've thought about all the people we could get together in a place for a quick 1 hour conversation about how do we talk to each other, refer to each other, what that could kind of achieve, which is some of what Matthew sort of I think built into his project really. It can just sometimes take a little bit of time to create something that will solve a lot over a longer period, and sometimes that upfront effort's really useful for everyone to kind of put in. Ben, I'm interested in your organisation. I mean, you must experience some of these barriers as a service provider. People have mentioned in the chat as well about what's available for people to be referred on to, and some of the disconnections between the services. I wondered whether you had any more advice for people developing those local place-based relationships.
That's right, Gemma. I think it really helps to kind of be very embedded within the local community so that you do have as strong understanding and relationships as possible with the range of organisations and resources that are out there. And there is still a huge richness in the voluntary sector to the range and variety of support that's available. So I think kind of that stuff that Lizzie's talking about in terms of keeping on top of that and maintaining those relationships is really important. I think that it is a really valid point that some of those resources and organisations have seen their funding cut back, and some of those have disappeared, and there is a real risk that we that we have social prescribing but not things to prescribe to, and it is that kind of piece of ensuring that there's funding available for those kind of grassroots organisations who do such valuable work, and in order for us to be able to link people in is really important. And then just in terms of the bit around kind of gaps within the mental health system, I think that we certainly encounter that at times, gaps, at times kind of barriers or long waiting times. There's not an easy answer to that. I do think that I'm quite optimistic about the potential of the sort of investment in community transformation in mental health, which is happening at the moment and over the next couple of years, to really enable some of those gaps to be filled in, some of those barriers to be removed, and for support to be much more joined up across the sort of clinical and non-clinical, and the development of integrated teams with clinicians from the mental health trusts and voluntary sector staff, such as mental health advisors, peer support workers, social prescribing posts, and people working around areas such as housing, benefits and employment. I think there's huge potential there, and we should see some improvements in how that works with this transformation programme that's ongoing at the moment.
Thank you. Yeah, it's probably a good time to also offer a plug for another digital tool that that's been created called the Good Thinking tool, which this year you'll see quite a lot of work going into helping people prescribe and supporting you in terms of exploring it, what it can do and its potential for prescription. It has workbooks, it has free apps for Londoners, it's funded for Londoners, and it's a great accompaniment to the type of tool that Matthew's described, which actually helps you navigate the services that are there as well. So sort of as an intervention, Good Thinking's great as a sort of an immediate intervention. Lots of really interesting things to support people with sleep, depression, trauma, lots of different things and ways to well-being, lots of tools they can use practically on a one-to-one with a link worker or in their own space in their own home. And then the navigation tool that Matthew's described helps people then to identify, well, what other types of services might I refer into, what's available. But Matthew, you mentioned the funding challenge, and it's come through very strongly in Ben's. I mean, I think this is something we're all critically aware of. It's you know, social prescribing to what? And we know that communities and community third sector organisations have been massively impacted by the COVID pandemic as well, which is making it increasingly hard for them to sort of further develop their services. So it's a time when communities need real resilience and recovery. You know, we sort of started to form, didn't we, this concept a few years ago of social investment, but sort of as a sort of a crowded thing with different organisations. Do you want to just say a little bit more about maybe some of your learning around some of that? And this might be for people in the room who are thinking about this from a big planning perspective. Perhaps they're in a integrated care partnership or system and they're trying to think about how do we crack that fundamental problem of funding a lot of these prevention activities. Absolutely agree with you that needs to be earmarked in any London recovery plan. But
so look,
yeah.
it's a big ask. It will take time. And my experience with these things is you start by building working relationships. And although everybody says, you know, we want the economic case, we want the Green Book analysis, actually, we're all human beings and like seeing things with our eyes. So Lizzie's examples of real people, you know, Ben's description of work, ultimately is what drives behaviour change. I definitely think that starting with small grants is the way to start. I mean, it's nothing remotely new here. I used to run an organisation, we used to run local grant schemes where the decisions were made with by people with lived experience. It was a single page application form, and we had 6 or 7 different funders, you know, and it actually created all sorts of new leader figures through the system. So I do know that works. I can say 100% confidence that works. It's just one-off grants, good for some things, but for many things, you know, you need repeat funding. You need confidence that they're going to still be around. having used to run many voluntary organisations, you need to know you're going to be around next year. You know, so we got legal advice on 3 to 5 year framework agreements. I did some work with a number of voluntary service councils, consulting on the basis on which people could expect longer term funding. And they were clear, look, we need to be accountable. Yeah, we can't expect a free lunch for 5 years, you know. So certainly what's built into Health Place is user feedback, you know, getting some simple, practical ways of tracking progress without trying to go crazy in terms of outcome measures. Yeah.
And that's so important, isn't it? I mean, part of the challenge for the health planners is knowing what are the services that you need. So really understanding and capturing the gaps that people are seeing and then when they see them. And then I guess, as you said, sort of then it's a kind of an opportunity to then look at new ways of funding and potentially all partners funding, because there's a health benefit to everybody. Somebody's mentioned in the chat box. You know, the NHS is making a benefit here. We need to think about how we're going to twist the funding to be able to kind of recognise the contribution that third sector's making. Exactly.
We've got oodles of economic kind of case for this. You know, I've got a very detailed cost benefit around combining in things like integrated personalised support with personalised support with that wraparound support. Yeah, the costs of IAPT and high, what I was talking before, very high failure rate for IAPT, bluntly. Yeah, but where people get wraparound support, the unit costs are actually, you know, remarkably low. So look, the economic case is really strong. I'd say it's all about building, you know, working relationships, you know, and then people will eventually get there. To the blindingly obvious.
Thank you, Matthew. Thank you. We've unfortunately pressed for time. We're going to be having the London Health and Social Care Prescribing Partnership and HLP are really thinking about this funding issue quite hard at the moment, and we have a project around a community chest as well, and other work that Matthew's done has been really interesting to see in terms of how he's developed those initial concepts of a local shared investment fund. So we're thinking about that. We'll probably have something on that later on in the year, so do keep an eye out for that. We'll keep making sure that we're promoting our newsletter to you, so you can get involved in that conversation. But we've reached time now. I did have a few other little participatory Slido things for you, but I think we've run out of time, and I just wanted to make sure that there was enough time to answer some of the Q&A and important questions that had come in. So I'll just finish by saying a big thank you to our speakers, a big thank you to my team and to people at the Learning and Work Institute who helped with a lot of the coordination and organisation of the session. A thank you to everybody who has put information in the chat. We will be following up with some of that. We'll be responding to some of the things that you've put in there, and to any individuals who are struggling with kind of navigating the system at the moment, we will try and follow up with you too. So everything's going to be shared. The findings from the workshop will be shared, and the kind of slides themselves. So thank you everybody for coming today and over a busy lunchtime. I hope you've been eating while we've been talking, because I don't know about you, I'm really hungry now. Okay, have a good rest of your day. Thank you everybody, and Mental Health Awareness Week. Keep watching what's coming up. Take care. Bye.